Throughout this summer education series, we're going to be speaking with and welcoming several of our closest partners who helped us expand our services in response to COVID. And I'm so pleased to introduce you to one of those partners today, Jessica Gosa. Some of you may know Jessica, but for those of you who do not, she's the Executive Director of Foodnet Meals on Wheels in Tompkins County. Jessica oversees the administration, programs, and strategic plan of the organization. She has over 14 years of leadership experience with human services, healthcare, aging services, and consulting and research. Jessica holds a bachelor's degree in social work from Shepherd University and a master's in social work from SUNY Albany, where she completed a John A. Hartford Gerontology Fellowship. She's also the Vice President of the Meals on Wheels New York State Association, which serves as the principal advocate and leadership organization for Meals on Wheels and other food and nutrition services providers in the state of New York. Thanks so much for joining us today, Jessica.
Thank you so much, Natasha. I'm so grateful to be here with you, and also just want to say there is so much admiration and for the work that the food bank does. I've just been in awe and just really, really honored to be a partner.
Thank you. The feeling is so mutual. We have a lot to talk about too, because you've been doing some great stuff.
Yeah.
So Foodnet Meals on Wheels provides meals to seniors throughout Tompkins County. That's kind of the elevator pitch, if you will. But can you talk a little bit more about the specifics of what you do and the people that you serve?
Absolutely. Foodnet Meals on Wheels, we always say we're combating some of the biggest threats to healthy aging: hunger, isolation, loss of independence. At Foodnet, we provide about 170,000 meals to more than 800 older adults and others in need all throughout Tompkins County on an annual basis. Our meals are certified by a registered dietitian, and we cook all of our meals every day. They're cooked fresh right here in the kitchen. We have 9 meal delivery routes, and this number is always shocking for people. We drive about 9,000 miles every month across the county. We provide home meal delivery, which I think is our hallmark service, the service that people think of when they hear Meals on Wheels. We also provide congregate dining. I should say pre-pandemic, we were providing congregate dining, which is a social dining program with dining rooms located throughout the community. We also offer comprehensive nutrition services, which our registered dietitian provides, nutrition assessment, counseling, and education. And then newer to our service, something that we were always doing, but we really enhanced it, was our referral coordination services. We hired a case manager, and the reason why we felt that it really required expansion is what we were finding on assessment and admission to our services, that we were setting folks up and they had really would benefit from a number of other community services and really weren't sure how to engage with them. And we found that we were kind of point of entry. Folks were willing to take our service and would benefit from many other things. So our case manager sometimes helps folks get connected to a home health aide or personal emergency response system. If there's somebody who's been falling, sometimes we find that people would benefit from SNAP and didn't know that they qualify. So this case manager spends a lot of time, and she might be on the call, Lisa, who connects people to really valuable services in the community. And you also asked about who we serve. In the home meal delivery program, our clients are homebound, and that doesn't really mean that this person never leaves the house ever. Homebound is that they have some sort of challenge happening where it's difficult to get out and cook or shop for themselves. This could be due to frailty, it could be due to illness, it could be a temporary situation. About 52% of our clients live alone. 60% we would consider frail disabled. And on admission to our service, about 50% are at least moderate to high nutritional risk. That's what we find during assessment. In the social dining program, the congregate program, that program is really designed for an older adult who might be able to get out and about some, but would benefit from the consistent, nutritious, healthy meals. But there's a real emphasis on socialization for that program. So we also bring nutrition education and programs from other organizations into those sites. And one thing I like to tell people that is really unique about our service is that it's really flexible. So we have short-term clients and we have long-term clients. We have clients that interact and are part of our service because maybe they've had a heart attack and they're recuperating at home, or maybe they are getting cancer treatment. Maybe they've had a hip replacement or a knee replacement, and our services are temporary for them. They use our service to get access to nutrition while they're healing and getting better, and leave our service once they've improved. And then we have others that are more long-term and are really using us more as a primary food source. And in that flexibility, what I would say is that we're really serving folks across all income brackets. There is no income eligibility requirement for our service. So we have some that are able to pay for their service and do. We certainly don't make that a requirement. And then we have others that aren't able to do that. So there really is quite a bit of flexibility in what our clients would look like.
Right. Holy cow. So it sounds like obviously you're doing a lot more than just delivering meals. It's tremendous. And you know, in your answer, you talked a lot about nutrition and the nutrition work that you do. So can you explain why food security and nutrition is so critical for our senior population?
Yeah, absolutely. You almost said it in your question. We've always said that we provide more than a meal. And pre-COVID, with the more than a meal model meant that we were delivering meals with a safety check and a friendly visit. That friendly visit is hard to do right now because of some of the precautions that we've had to put in place. But that human connection part of the service, we've always said is really equally as important as the meal for many that we serve. You heard me say we've got so many people living alone. And so that contact that they have with our services really might be the only contact that they're getting in a day. We've had situations where our drivers are maybe preventing falls because they're able to observe something that looks unsafe. We've also encountered situations where we've had clients that are in really acute situations when we arrive, where we have to get them help. Maybe they've had a fall, maybe they've missed their medication and they seem a little off kilter, maybe they don't have heat. There's a number of situations that we encounter during those meal deliveries. And then the other thing I really, really like to emphasize when I get asked to talk to the community is that food insecurity and malnutrition for older adults is incredibly complex. It's not just about access to or limited access to financial resources. There are social and medical and environmental circumstances as well. You know, for older adults, it could be a medical situation where they've started a new medication and there's appetite loss or maybe appetite increase. It could be that a social challenge where somebody recently lost their spouse and are eating alone for the first time, and food and dining has just become less appetizing and the person is losing weight. It could be that medical challenges impact the person's safety ability to cook. There could be cognitive impairment. And what I'll say is those complexities and those nuances that I'm sharing are really accurate across all income brackets. It's not necessarily about just not having enough finances to access meals. Senior malnutrition is also incredibly pervasive. It accounts for approximately $51 billion of healthcare spending. I know it's amazing to put it that way, right? Nationally, 50% of community dwelling older adults are considered malnourished, and 33% of older adults admitted to a hospital have a malnutrition-related diagnosis. So I think what that tells us is our services are important, right? And our seniors need us. Food is health, and our clients are vulnerable by age alone, and many have underlying conditions on top of that. And so our services, I would say, have become even more critical during a time like COVID.
Yeah, absolutely. And so like many organizations and businesses, Foodnet Meals on Wheels had to quickly pivot your operations in March due to COVID. Can you explain how your services have changed over the last 5 months?
Yeah, you're using the word pivot, and I think that's probably the right the right word to use. I feel like we've become experts in pivoting, and that's exactly what we've had to do, time and time again, virtually across all of our operations. And I'd say the pandemic has really underscored the significance of our services. I'm sure that's true for you too. Here at Foodnet, we in March alone served 38% more meals compared to 2019. Fortunately, that demand didn't stay quite that high. It's come down some, but we're still delivering about 18% more meals compared to 2019. When COVID invaded our lives, as I like to say, we really, really looked at our staff and volunteers and clients and knew that safety was going to be our priority and become our everyday reality. And in the beginning, we really worried quite a bit about what would happen if we had to close for some reason. What if we had a closure because we were sick, or maybe a client was sick and that we would have to quarantine? We're very concerned about what that would mean for our clients because of all the reasons I shared about the vulnerability of our clients. And so we came together with the United Way of Tompkins County right away, and this is what's really amazing. In like 3 days, we secured funding. We got a whole bunch of food delivered here. We had a food vendor donate a refrigerated trailer for us, and brought in volunteers, board members. I think even the Cornell women's hockey team came and helped. And we packed 8,750 meals in just a couple of days on top of our normal meal delivery, daily meal delivery. So each of our clients would get 14 days of emergency frozen meals. And we were able to pack enough and have enough inventory on hand that we're able to provide that for new clients that enroll in our services. And so our thought was, well, if something terrible happens and there's a pandemic related service disruption, our clients will have something in hand. Then also some of the challenges that came to play, we had New York State pause. Foodnet's an essential service, so we stayed open, but also came Matilda's Law. And if you recall, that's not a law, but it's strong guidance that encourages older adults and individuals with underlying conditions to pause and stay home. And our workforce, over 50% of our staff are age 60 and older, and our average volunteer is age 70. So we knew we were going to have to put a lot in place to be able to accommodate staff and volunteers. And one of the things that we did, our operations director here is just phenomenal, and came up with this master plan in moments where we would do a rotating meal delivery schedule. So essentially we have 2 teams that deliver. People still get the same amount of food. In fact, actually they're getting more food on their delivery. We're just coming out less frequently. And what that did is it created an internal pool of staff and volunteers to mitigate some of those shortages. We also transitioned our congregate meal program because we can't socially dine together right now. We offered all of our clients an opportunity to receive home meal delivery. So all of our dining rooms are closed and remain closed at this point. And our deliveries, which I think is the hardest safety precaution we've had to put in place, is they're contactless now. And so we're really sad to not be interacting with our clients. And we know that they miss us and we miss them, but for safety reasons, the contactless delivery really is the best option in terms of being able to continue and limit the opportunity to have some sort of sickness exposure. Because we're not doing that friendly check, we were really, really worried about our clients. So we partnered with our county office for the aging, who has been doing reassurance calls for our clients daily. Which is just, an obscene volume of calls that have to happen. But there's a great staff there that has just been handling that with finesse. And then our nutrition and case management services all went telephonic, and are happening remotely. So as you can hear, lots and lots of changes. I could probably talk all day about the safety and the intricacies of what we've done, but that gives you a good sense.
Yeah, I mean, it's just incredible. Oh, wow. So our organizations have partnered together for many years around the issue of senior hunger specifically. Can you talk a little bit about our partnership and how we work together during COVID?
Yeah, absolutely. Well, like I said before, FoodNet's a really proud partner of Food Bank, and we share a lot of the same priorities. So working together only makes sense. And I'm also a member of your advocacy committee because a lot of our work has been around aligning our advocacy work to really strengthen our ability to serve more in need. And I think one of the shining moments of COVID, if there are some shining moments, is the partnership and collaborations that have come together so quickly. You know, I remember, and Natasha, you probably remember this, we got called in on a Sunday to the emergency operating center. You know, the county had just declared the state of emergency. The schools had closed that Friday, I believe, and,
Yep.
and we were sitting in a conference room together. And I remember us really connecting even in that room and just sort of reminding each other that we'd be in this fight together, that our organizations would be there for each other. And that has stayed true. You know, and I think it was just days later after that, we were on a call. It was you and me and some of your fabulous team. And you guys were cooking up an idea that you were going to pack all these emergency meal boxes and wanted to find a way to ensure that we would deliver those boxes to seniors because we were really concerned. And we also knew that some of the increase in demand that we were seeing with seniors was attributed to Matilda's Law. We have seniors that were staying home and sheltering in place that maybe normally wouldn't. And so the idea of really not just delivering our hot meals and meals, but to also provide a real variety that could be sustainable for folks to fill their pantries and have food items on hand so they could limit their trips to the grocery store. And that's exactly what these boxes did. You know, we had a 35-minute call, and then, you know, it's like the next day we're delivering hundreds of boxes. And, you know, and that is the beauty of what has happened is these partnerships and collaborations that sometimes would take a long time to think through the nuances. We're able to make magic happen, I guess. Yeah. And so I think that really speaks to, you know, how we've been working together and making sure that we're at the table when we're thinking about our clients has been really critical. And I think that's one of the shining moments of COVID. It's just shown how strong and how beautiful our partnership really is.
Yeah, absolutely. I guess there's nothing like a pandemic to demonstrate what's possible, right? And I think, yeah, you guys have been tremendous during this time and helping us reach our seniors. So what impact do you think COVID will have on your organization beyond increased demand?
Yeah, I think we're going to see the impacts of COVID for years to come. You know, I think that's sort of becoming our reality. And we're going to have to be really nimble. And on a positive, I think there's real opportunity to think very innovatively right now. Now is the time to really think differently about our services. What are some of these innovations that we put in place, expanding our partnerships? And I've been really saying to our team, you know, maybe we don't necessarily have to go back to exactly the way it was. You know, some of these things that we're learning can really take us to the next level and maybe even move us even more quickly through some of the work that we have outlined in our strategic plan. Financially, FoodNet receives a tremendous amount of government funding. And while government funding is great, this is a hard time to receive a lot of government funding. And so there is a lot of uncertainty, you know, and so more than ever, we're going to have to diversify our revenue streams and be nimble and think creatively and expand partnerships and to really be proactive to plan for inevitable shortfalls.
Right, right. And then in terms of, I mean, how the community can best support this critical work, I mean, beyond supporting both of our organizations financially, which we always want to encourage for sure. How else can people support this critical work?
Yeah, there's a couple ways that I tell folks, you know, while we've reduced our volunteer pools down a bit for safety, there still are opportunities to volunteer. So if folks are feeling compelled, I definitely encourage you to reach out. But I always tell people that one way that you can really help is to help raise awareness around the challenge of senior hunger. Help people understand that it really exists right here in our community. This isn't another community that we're talking about. This is our community, and it's right here. It may be your neighbor. So take something you learned today and share it, and then remind your own neighbors that we're here. And those are really valuable, supportive things that go a long way for us.
Absolutely. I think just from what you shared at the beginning, you know, people can come in and out of the program, and there are many different times in people's lives when they could really benefit from the services of Foodnet Meals on Wheels. So I think that's a good reminder for folks. Jessica, thank you so much for joining us today. I could talk to you for hours. And it was just really great to be able to interview you and learn a little bit more about the work that you do, and particularly highlight this issue of senior hunger. Thanks so much.
Yeah, thank you so much for giving me the opportunity. I appreciate it.